Good evening, everyone, and thank you for joining me tonight. My name is Anas Al-Qassam. I'm a trauma surgeon and bariatric surgeon who has been in medical missions at least more than 15 times in the last 5 years, particularly to Syria during the Syrian war, the most aggressive war that we have witnessed over 80 years. I have been working with OSAM, the Union of Medical Care and Relief Organizations based in Paris, and worked with other organizations, including MSF, at the beginning of the Syrian war. I'd like just to shed the light on how the medical needs and the challenges are quite different in a conflict and war zone in comparison to first world countries. When you go to a trauma or war zone, you will be bombarded with lots of trauma cases on a daily basis. In one day in Aleppo, we received over 30 severely wounded cases. Each one of these cases in a hospital like Mississauga or Toronto would take you several hours, 7 to 8 hours to treat. Imagine the challenge to receive all these cases and to take care of these patients during the surgery and afterward in the intensive care unit. There are certain surgeries that are badly needed in a conflict zone or a trauma or war zone, such as plastic surgery for the post-trauma wound care, which is a big shortage in war zone. And in the acute phase, you need to have vascular surgery, which is a big shortage as well, particularly in Syria and other war zones, since most of the acute injuries are bleeding injuries and need immediate fixation to the limbs and immediate repair to the vessels which are bleeding. And that's the main reason of early death after trauma is bleeding. So you have to stop the bleeding as soon as possible. And in addition to that, there are challenges conducting surgeries without medical supplies. So in many cases, we go to a war zone or conflict zone like Syria, Yemen, and other places in the war where you need certain sutures, you need certain equipment, and you don't find it. So you have to be innovative. You have to live with what you have there. We have had great engineers like Dr. Shire from Canada who invented a manual device, a vacuum device. Doesn't work on battery, doesn't work on electricity. It just works on basically pressure. And the patient can apply pressure on that device so it can provide continuous negative pressure to help the wound healing. You have to be innovative and you have to use what you have. In many cases, like in Aleppo, when we used to go there, we did not have 24 hours electricity. In some days, we don't have electricity for days. So we have to work with the fuel that you have, and basically it's the diesel at that time to make the generator work, and you can only work the generator for the OR because the rest of the hospital can survive, but the OR is so essential and crucial for the patient's survival, so you cannot cut the electricity of the OR. I'd like to support the campaigns like Doctors in Danger, which is raising awareness about the doctors, whether in Syria or other conflict zones, putting their lives at risk. And they know that they can get out of the country, they can go to Turkey, to Jordan, to Lebanon, or to Europe and Canada, but they prefer to stay in the war zone to treat the patients, to save lives. We have to be shoulder in shoulder with them to support them. And that's what we're doing in our organization, like many other medical relief organizations. There is a big impact of the shortage of doctors affecting those injured. And I can give you just one example. One day I was in Aleppo. I was on my own in one of the hospitals, and one of the bakeries was unfortunately bombarded by airstrike, and we had influx of injuries to this hospital. I received 2 injuries. A woman who was in her mid-40s, as I recall, who had significant chest injuries and needed immediate surgery. It was a very complex injury. Most of the chest was open. And a young fellow who had a simple injury into the groin and who was severely bleeding from the groin, but no other injuries, obviously. I started with the woman because I had only one team with me. I had only one nurse and one anesthesiologist. But unfortunately, when I saw the young fellow coming with a bleeding injury from the groin, and that bleeding injury for the next half hour or 1 hour, if it's not treated, likely he will die, I decided to quit working on the woman to save the life of the young fellow. Not because I preferred him to her, but I had to step back for a minute and use my judgment to the best of my knowledge. And I figured fixing his injury likely will put him back to life, as opposed to her. I may work for a few hours and for sure we're going to lose the life of that man. But at the end, I'm not sure I'm going to put her back to life. It's so difficult when you work with shortage of doctors. And that's why it's so crucial to support the doctors working in conflict zone with all what we can, because they are saving lives on a daily basis. I'd like to give some security precautions and advices to the medical professionals that working in conflict zone or would like to join organizations working in conflict zone. One of these things that we learned in the last 5 or 6 years is to work in safe areas as much as possible, not to go into the conflict areas or where there's heavy fighting, even at the suburb or the sides of the cities where there's fighting, where you can bring the patient safely to you as opposed to you being involved in an area which is quite risky at your life. And at the same time, in the building or the hospital where you are operating and working, try to work in the safest spot in that building, and usually it's the basement. Do not work in the high level areas because it's very high risk for any airstrike to be hit. And always try not to wander around and leave the building, particularly at night where there's more risk at your life. OSAM is a medical relief organization that was established end of 2011, and we have become part of it, working with hundreds of colleagues from Europe, Turkey, Middle East, US, and Canada. OSAM is providing healthcare to thousands of patients in conflict zone. Currently, it's operating the largest trauma hospital in northern Syria at the border with Turkey, with more than 1,000 trauma and other general surgeries being performed on a monthly basis. We provide the hospital with all what we can, medical supplies, equipment, in addition to having a CAT scan 24 hours running there and a blood bank, fully functioning blood bank. We support the staff. We support the salaries of the heroic staff working in this hospital, in addition to many other primary healthcare clinics and mobile clinics, which are very essential in conflict zone, since you have very difficult access sometimes to certain areas, and you need the mobile clinics with physicians and nurses to reach to the injured and to reach to the trauma patients, so we can provide simple care until we can move them to tertiary center like this hospital. We provide mental health care as well to severely mentally health injured patients or traumatic patients with psychosocial support on the ground in Syria and other places in the neighbor countries. People can either donate to our organization so we can continue providing the healthcare providers on the ground with all the resources they need to continue saving lives. People can raise awareness by spreading what we're doing to their neighbors, to their friends, to their colleagues, and reach out to the NGOs, to the organizations, and reach out to the government, to the MPs, so they can keep raising awareness and keep supporting the humanitarian and medical relief work that we're doing on the ground. In addition to that, if you have healthcare providers, if you are physicians, if you are nurses, you're more than welcome to join our team and go in medical missions on the ground. I would like to appeal for the people to donate to OSAM so we can continue with our services to save lives, whether in Syria, in Jordan, in Turkey and Yemen, in the Rohingya camps, and elsewhere in the world. Thank you very much for joining me tonight, and thank you for listening to me.